Certain populations have been affected by the coronavirus more than the others, such as African Americans, Hispanics, and also our elderly who are 65 and older. What can be done in order to mitigate the risk of the coronavirus on this special vulnerable population? Hello, I am Rajitha Bommakanti, registered nurse, faith-based holistic coach, and founder of Healthy You Lifestyle Center. If you want to develop healthy habits for life one step at a time, click the red subscribe button and the bell icon now. Coronavirus has affected certain populations more than the other. So join me in learning what can be done and what are the health organizations doing, if any, to help this population. I am having a conversation with Dr. Smith, Willie Smith from Atlanta, Georgia. He is an internal medicine physician practicing at Emory University Hospital Midtown. Let's learn together what can be done in order to mitigate the spread of the coronavirus in this special population.
Thank you for joining us today. Dr. Smith is from Emory Midtown in Atlanta, Georgia. And since you are located in that prime Midtown area, Dr. Smith, in Atlanta, just wanted to ask you, y'all get like variety of patients in your hospital. Can you tell me how this is affecting elderly patients more, the COVID? They are getting much sicker than the other generations?
Right. Yeah, absolutely. And thanks again for having me on to be able to discuss this issue of COVID-19 within our community. So one of the things we have been seeing has been a number of different patients of all ages, but especially those within the elderly population coming in. And it's a number of reasons why that's happening. So certainly as we get older, our immune system tends to go into a senescent process where we don't have quite as robust of an immune response as we did when we were younger. So we do see a lot of patients that are affected not only by COVID-19 but any other type of infectious process a lot more easier when they come in. Secondly, as we get older, we sometimes develop more and more comorbidities, and that's been one of the aspects that we've been seeing in our elderly population. That many of those patients that are coming in have more than one thing that's that they're dealing with. Whether there's heart failure, COPD, diabetes, hypertension, any of those things. So that just puts them at a higher risk of developing complications of COVID-19. And then lastly, also kind of where our elderly are situated. Certainly one of the hotspots across the U.S. as well as across the world has been our elderly that are housed in nursing homes. And so that population, for those same reasons of their immune system as well as their underlying comorbidities, just put them at a higher risk of being admitted COVID complications.
Since you touched about that immune system, let me ask you: is it inevitable as we age, our immune system goes down, or can we do something to keep up with our immune system? Is this like, am I going to have my immune system drop each day as I'm aging?
Gotcha. I look at it this way. Certainly, as we get older, we do, of course, get older, and all of us have to deal with mortality at some particular point in time. So what we try to do is just maximize life as much as possible. So certainly, just in our population that is elderly, that is getting up in age, again, there's just immune responses just wouldn't be quite as sharp as it was when younger. Similar, no different than any other of our physical processes. We may not be able to jump as high or run as fast in our 80s as we were when we were 8 years old. So that's one of those just natural conditions as we age. But within that, as we recognize those things, we're able to provide provide counseling to our patients on what to do to, again, try to maximize things as much as possible.
Okay. So for those that are like in nursing homes, things like that, since they are at a higher risk, can they do something? I know as we are going down with the numbers and things like that, since there's still so much unknown, if another pandemic comes around, what can they do in order to safeguard, protect themselves because they're in that situation?
Sure. So I guess it'll be a combination of things that the healthcare providers within those settings can do, as well as the patients and themselves can hopefully do as well. So, well, let's start off with the patients. So, as much as possible, even with whatever that patient is dealing with, as much as they can stay active, as much as they can stay mobile, any type of physical fitness, if you will, can try to help stay involved in any type of disease process. In addition, with the recommendations and counseling with that particular physician that's working with that patient, looking at other proven vitamins and supplements such as vitamin C, vitamin D, zinc, that may be a part of their ongoing profile to help with that process. And then, of course, from the healthcare provider standpoint, just a thing that's been hammered to us for so many years, which is the hand hygiene, and also, of course, within the pandemic, the appropriate personal protective equipment to just try to help minimize these type of exposure.
Okay, all right. And I've also seen some seniors when they're hearing all this news on television because of the numbers that are getting on the ventilator. Some are not making through out of the hospital. They are panicking and trying to go back and revisit their advanced directives, and some are changing their advanced directives, saying that they don't want any extreme measures to be taken on them. So is it safe to say, piling up a cluster of frail elderly in the same bucket as the healthy adults? What do you say about changing, going and changing? Do they have adequate information to make those changes that they are doing? Or do they need more info before they do, so that we can, as a healthcare provider, we can respect their wishes when they come in?
No, very good question. So there have been a lot of different discussions as it relates to this and how best to approach our patients as they're thinking about end of life situations in context of COVID-19. One of the things that's a challenge to providers in talking to the patients and family members is being able to try to remove some of the fear aspects such that patients aren't making an emotional decision, but more so providing some of the facts and appropriate guidance to make an informed decision altogether. So while we have been seeing a lot of the mortality being from the elderly population, and especially within our hospitals as well as across the world, we do want to make sure that we are talking to patients and the family members to say, hey, based on your particular risk factors, here's what we're seeing, and also in context of anything else. So certainly if someone's dealing with end-stage cancer or any type of end-stage process such as dementia, they're already going to be at a higher mortality risk altogether. So in a sense, we should already be having those end-of-life discussions with patients and families on how they would like for things to be as that time approaches. But even more so, we just want to make sure that we remove some of the fear aspect and the emotional aspect to say, hey, here are the facts based on your clinical comorbidities. Here are recommendations on potentially how to proceed forward.
Okay, thank you. And, we are also seeing people of color, like African Americans, Hispanics, are disproportionately getting affected with this COVID, and are having a lot of other complications from that. Um, can you tell me, expand a little bit about that, the reasoning behind it?
Yeah, so certainly as the epidemic began, and as we were getting more information from March going into April, this became an issue that has been highlighted really in a lot of different areas, and especially in the United States. And there's probably not really one good answer on why people of color have been affected more so than other ethnic groups altogether. So a couple of the reasons that have come up. One of the reasons has been potentially just underlying comorbidities. There have been studies to show that, unfortunately, people of color tend to have higher and more severity of degrees of comorbidities compared to others, so which puts them at a higher risk of not only acquiring COVID-19, but dealing with some of the complications related to that. Also, too, some of the other theories have been exactly from a socioeconomic status. Where are these patients working? So if a lot of patients are working more front line, if they're in industries where it requires kind of sort of high touch, high visibility, high interaction with other people, that by definition they're going to be exposed to that many more people that could have the virus and therefore potentially get sicker. So that's been another issue as well. And also too, just kind of living arrangements. One of the things that did come out was that it's possible for some people of color, based on their living arrangements, they may not be able to physically distance as easily in other places. So if you're in a potentially multi-generation household, you may not have quite the large space to be able to, in a sense, kind of quarantine or isolate if you're having any symptoms. You could be at higher risk of being able to develop COVID and develop some of the comorbidities associated with it. So there's a lot of different reasons on why that could potentially be the case.
With Hispanics, quite a few are also working in the meat processing areas where the eruption has been more. Is there anything that they can do to, kind of protect themselves? Some of them are required to go back to work.
Sure.
They don't have the luxury of staying back at home because of that exposure.
Right. And that's a very tough situation altogether, especially trying to balance the economic challenges along with the health challenge they oftentimes and will forever continue to go hand in hand in a lot of ways. So in situations like that, similarly to what was mentioned for our elderly population, again, with the consultation of that particular person's physician, if they can somehow, again, get some of those immune boosters in your system, such as vitamin C, vitamin D, zinc, to try to help mitigate some of the risk of developing COVID and the risk of developing some of the complications related to it altogether. And then, of course, not as familiar with kind of the processes that happen within those factories, but as much as possible as the owners, employers, and managers at those locations can try to provide, again, avenues where our patients can try to stay clean as much as possible. If masking within those areas can be appropriate to do, just those different measures as well, again, to try to minimize as much as possible.
Okay, thank you. With African Americans, because of the other comorbidities they have, that might also have played a role in this, which we do see quite a bit, not just during this time of COVID, but they don't have adequate access to healthcare, the resources. What, if any, can we do to help them with that? And if anything, healthcare organizations, how are they addressing this, affecting this population so much more compared to the others?
Gotcha. One of the things that people have been discussing just across the medical literature and even across the just other airwaves of news media is just how much the pandemic has highlighted things that we've kind of known for quite some time as far as the disparity of healthcare outcomes with people of color altogether. And so certainly some of the efforts that was being done prior to the epidemic are still ongoing as much as possible now. Just to name a few, so certainly there have been a lot of different organizations that kind of reach out to the community as much as possible, as far as whether that's things through the Department of Health, health screening, health clinics, different clinics that are trying to provide some type of free services as much as possible to try to be able to help alleviate some of those conditions altogether. altogether. I think about Mercy Mobile, for example, as one potential avenue that some patients have access to. And of course, within our partners at Grady, a number of different health care clinics across the city. As it relates to the pandemic in and of itself, one of the biggest issues has been how can we get increased testing to those people that could be at highest risk altogether. And certainly over the last several weeks, the U.S. has tried to do a better job, and I think it has gone at least in the right direction of trying to get that many more testing altogether. So remember in the earlier days when we didn't have as robust testing, having worked through the CDC, sometimes it would take 7 to 10 days, if that, for a test to come back. And thankfully, we can have test results back within minutes now, if you will. And a lot more testing sites are being opened up. I was just listening on the news today how there are a couple of areas across the city that are actually providing testing churches. So being able to just utilize those areas within the community that are easily accessible to patients to be able to get the access to that care are other strategies that different organizations
you. Thank you. How would the people talking about the testing that, yes, there's a widespread of testing being done all over the place, easily accessible now to get the testing done. But as we hear in the news, some tests are not accurate. They're coming false positive or false negative. How would you know to go to a reliable place to get tested that is, and good testing quality from a good lab? So how would you know that?
Yes, that's a very good question. There are a couple of studies that had come out, I guess, back in the early parts of April that were looking at the sensitivity and specificity of many of the tests and also the different routes, so whether that was from a nasopharyngeal swab, oropharynx swab, and then, of course, there have also been discussions about being able to test the virus through saliva as well as stool and all these different avenues. There are also so many tests that are out there, and then there's, to your point, how well is that regulated, and which tests are good tests and which tests are not so good. I think the best advice that we can provide for our patients right now is certainly to work through their particular Department of Health, and in this case, the Georgia Department of Health. They do have resources to say, here's where testing is provided, and hopefully through that will be able to provide some level of reassurance that if it's listed on the Georgia Department of Health site, that hopefully that test has been done, not only by the person administering the test, because that also can play a role into false negative, false positive, but also the reliability of tests that particular site may be using. Hopefully it can be at a high enough level that can give confidence to patients as well as to the persons that are interpreting the results that this was a good test that was done.
Okay. And as also how the recommendation, to social distance and putting the masks on and all that. And, the mask business has blown out of proportion all over. And just the other day, I was watching on the news, they were advertising masks, antibacterial masks. What do you think about that?
Oh, wow. So breaking news to me. This is the first time I've actually heard about antibacterial masks. And interesting, of course, the mask situation has been such a controversial topic, especially as much of the pandemic was unfolding for us here in the United States. There were articles that were pro-mask. There were articles saying, well, maybe masks don't quite help as much. And I think as of right now, certainly within the healthcare community, especially at our places of work, we decided to just go with universal masking. If nothing else, was really to try to help curtail the aspects of patients who may be, or even people who may be asymptomatic, but still potentially could be shedding virus altogether. So that's a very interesting one about the antibacterial one. I guess probably more research there to be done, but certainly I think as people think about the areas that they're working in and just seeing what is going to be most appropriate as it relates to
Okay. Yeah, because people get taken advantage of because they're thinking they're protecting themselves and shelling out all this money.
That's correct.
Yeah. So yeah, I just saw that ad on TV. So
Right.
I was like, that's the first time I've heard antibacterial mask that they're selling. So
Well, yeah, one thing I will add to that, Rajitha, is that I will say that for people, when it comes to masking, we do want to make sure that they understand if they're going to wear a mask, why they're wearing the mask. And as I think as the adage goes, if I wear a mask, I'm protecting you from me, and if you wear a mask, you're protecting me from you. And so it's mostly the issue of if I'm sick and if I'm ill, then anything that I potentially could be shedding by me wearing a mask, it prevents other people from picking up something from me, and not so much that if I'm wearing a mask that somehow that's going to magically block things out of the air from others. It's more so me not infecting other people. So I think more so we just need to just educate people that if you're going to be wearing a mask, here's the reasons why to wear a mask, and also if you're going to wear a mask, make sure you're wearing it appropriately. And certainly we've seen some interesting situations where people have worn masks in unique ways, where it's just really kind of either covering the lips or just covering the chin, and it's like, well, you might as well just not have it
not,
on at all.
yeah, yeah. You might as well not wear it.
Yeah, exactly.
That's a very good point. Um, I wanted to. I was just thinking about it. One of the other things since this COVID started, uh, all the hospitals plus the rehab centers, everybody, to limit the COVID transmission, that they have stopped the visitors coming in. Uh, so how is that affecting, our patients, especially elderly again, when they're in the hospital, they are totally out of place. Even when they have the family members, they're confused. And in order to reassure them and also communicate with the family, how are y'all doing?
Yeah, so certainly one of the things that I do as a hospitalist, and of course, is take care of the hospitalized patient. And one of the things that's really key in how I approach patients, and really for what many of the other providers do, is relying on that family support in a lot of cases. And certainly, while we understand the rationale to limit visitors, it has been a challenge altogether on a lot of different levels. And one of the aspects, of course, is as anyone is going through any type of health crisis, the more that they can have some type of support for family members and loved ones to just be there to just not only advocate for the patient, but also to be able to just kind of hold their hand as they're going through a very difficult process. To not have that is very challenging. So a lot of patients and family members have felt this sense of isolation, not being able to be able to physically reach out and show affection and love unto their loved ones, and also similarly not being able to be here real time to be able to ask and answer questions with the clinical teams. So it has been a challenge, but with that, we've been able to try to figure out ways to overcome that challenge altogether. So certainly, we've been doing a lot more increased phone calls, phone conferencing, video conferencing with patients and family members to try to help with that altogether. Even there are times where physicians, nurses, other staff members have just try to take a little bit extra time being there with that patient, knowing that at least in this particular period of time that we've been the only other source of human contact for them. So ways that we can just show that little bit extra empathy that maybe we normally wouldn't have always done because they would have had a family member there. But I think all of us are trying to step up and provide that best as possible.
Okay, thank you. And wanted to ask you, what is the one advice that you can give to our audience to follow from what you
Yeah.
have just said?
Yeah, absolutely. I think one of the things that this epidemic has done has made us all become experts in how to understand things related to coronavirus. We've all become, I think, more experts in our practices as physicians, as nurses, as therapists, as epidemiologists, as public health experts, politicians, economists. Because one of the things that we're seeing is that this COVID-19 has really just kind of cut through all those different areas altogether. And it has really highlighted just how integrated the healthcare of us individually and as a society is so integrated and impacted by all those different scenarios. So one of the things that I would just advise our clinicians and other people within the healthcare industry is just continue to learn as much as you possibly can. Learning perspectives, learning even other counter perspectives as it relates to things COVID-19. There are so many different ways of information. Certainly, there are things that we didn't know back in March of 2020 to things that we now know from April 2020 to May. We're still going to be learning new things in June and July and going forward, such that, Lord willing, we're able to make the 2021. We'll look back and say, wow, look at how we managed those things related to the pandemic. There were some things maybe we did well, and we'll see maybe some things that we could have done differently. But throughout this entire process, the biggest thing I just want all of us continue to do is just, again, learn as much as we possibly can. It's always going to be something new. Something we thought was great one day may not be so great the next day, and vice versa. Something we thought wasn't good, it's like, wow, okay, maybe we should have done that, and now let's go ahead and implement it. So as much as we can learn, as much as different people that we can learn from to try to be able to do the best we very much can for all of our patients.
How about for our lay public outside, that are not in medical field, but they are getting so much of information out there. It's information overload, bombarded. And as you just said, everybody is becoming an expert in healthcare now. Politician, every single person knows how this works and what medication they need to self-medicate and treat themselves. So how can they go to a reliable source? What is that they need to follow on a regular basis that's not going to change day to day?
That's a very good question as well. And that's certainly your experience as a nurse as well. We certainly have had those situations where our patients come in and say, hey, doc, found this on the internet. I'm like, oh boy, here we go. And so, for our and that hasn't changed even within the pandemic here as well. So the best thing that I can tell people is that as far as for me, and then it's just one doctor's opinion, but as far as reliable sources, certainly the CDC and prevention website I think is very reliable, and then certainly I think information within the Georgia Department of Public Health. I think those two for sure. And then after that, just like with anything else, certainly we all have brains, we all have intellect, and really just having to just kind of use that ability to be, again, see what's being said, try to sift through as best as possible, just like we would with anything else, and then try to come up with the most wise and rational decision on how best to take care of ourselves with the information that's presented to us.
Thank you. And our audiences are from all over the globe, so they can just follow their local public health department guidelines, correct? That's whatever right. The guidelines that they put out. Dr. Smith and I are in Atlanta, Georgia, so that's the reason we are talking about the Georgia area. But wherever you are, you need to follow your local guidelines, whichever country you are in. All right. And if they need to ask you additional questions, they need to follow you, where can they find you, Dr. Smith?
Sure. Yeah, so I'm super old school. I'm just an email kind of guy, so they can reach me at whsmith@Emory, that's EMORY.edu.
Okay. All right. Thank you. This was a very good conversation with you, catching up. I used to work right alongside Dr. Smith at Emory Midtown, which I am not there anymore, which I do miss the team over there. But I moved to closer to home. And thank you for your time with us today. And I really, really appreciate you joining us this morning with the conversation.
Rajitha, thank you for reaching out, and it was great to be able to talk to you and your audience about this very